What's your staff?
We now have 80.
80 people?
80 people, yeah. That is everything. Clinical staff, administrative, construction people building, the guards, people looking after the place, cleaners, all that.
So how many people do you see in a day at your clinic?
Well,
what's it called?
We have 2 clinics.
2 clinics?
Yes, we have 2 clinics now.
Okay. 2 clinics, and I imagine then you're going to be franchising and growing and growing.
Well, I don't know. I mean, we could do if it continues to work and we get the support that we would need, because I can't reach into my own pocket and pay for it. I have to have people, and predominantly it's from Canada, from people in Canada.
And is that what you're doing right now?
Yes, that's what I'm doing here back in Canada, talking to people, telling people what we're doing and seeing if they would like. There's an awful lot of money. There are a lot of people with a humanitarian heart and with compassion. But what they do need to know is that what we are doing is credible and accountable.
So, having been doing this for 10 years, what are the greatest challenges for you? Where do you end up kind of feeling like, okay, if we can get this?
One of the great challenges is, as I was just discussing on email, just as you came in a little while ago, to the field director out there, who is a man called Pat Laforey, who's from Toronto, and is the difficulty of accomplishing things in Africa where there is a factor of 9. By that I mean it takes 3 times as long to accomplish 1/3 as much. You just can't do things. Nothing works. The phone, I can't speak to my wife on the phone. I haven't been able to speak to her for 3 days because the phones don't work. Probably there have been rains and therefore the wires have got wet so it can't get through. It may well be that there is no electricity in the house now. Maybe the water isn't working so there's no water. Probably the roads are up and you can't get that. Maybe our vehicles are no good and there's no one to fix the vehicles, or maybe the person who did fix the vehicle didn't do it properly. It could be that we've run out of fuel. There's no fuel in the country, or maybe we're doing some construction and there's no cement in the country, which there hasn't been for 6 weeks. You know, for 6 weeks there's no cement. How are you going to build a decent house without any cement? These are the sorts of issues that we have. So that is one of the frustrations that we have.
Okay. And when we come back, I'm going to ask you how you deal with was it factor of 9?
Yes.
How you deal with that. Because obviously you have.
Yeah. Okay.
I mean, it doesn't mean that it still doesn't move slowly.
It does. It moves very slowly indeed. And you're right.
Okay.
It's a tough one. They should be donating doctors to Malawi, not taking them from Malawi.
Hi, welcome back to Close Up. We are hanging with Dr. Chris Brooks this week, and this next segment I think is going to be great because he is going to get passionate.
I like saying these sorts of things and seeing the reaction. Not a doctor? No, there isn't a doctor.
Okay.
Are we on?
Yeah, we're on. And
Let me tell you, there are no doctors. There are no doctors. We've just been having a little chat about it.
No.
Do you know there is a district hospital 50 miles from us, the nearest, and there are 300 beds in that hospital. Do you know how many doctors there are?
For 300 beds? Let me guess, 1.
No, none.
None?
There are no doctors. And the number of patients in the beds, you will see a head at one end and a head at the other end, and sometimes, if it's very busy, a head in the middle too. 3 people in a bed. And if you need any surgery done, it's not going to be done by a doctor. It's going to be done by a nurse and what is called a clinical officer. That is a sort of glorified nurse. Not a doctor, but he's a bit more than a nurse. He's got some training in surgical skills. And they will do it. So a cesarean section, emergency cesarean section. The baby is dying, get the baby out of the woman's tummy quickly, like right now.
I know that.
It'll be a nurse.
Wow. Holy cow. So who's the doctor there when you're here?
There isn't one.
Wow.
But I have 3 clinical officers. I have Eric and Kondwani and Martin, and they're good.
Who trains those clinical officers?
They have been trained in medical schools or in nursing schools, and also we do some of our own training too. And they're good. They're good people. They're intelligent, bright, and they have good hearts, and they are very anxious to do good work.
Why are there no doctors in Malawi? Why doesn't the government send, even if they had to, send some people to different countries.
Well,
to medical schools.
let me ask you the question. Why do you think doctors that have been trained in Malawi leave Malawi?
I guess because they don't get paid?
Yes, of course that's true. They don't get paid. And do you know why they don't get? One of the reasons is because there will be headhunters coming over from the UK and the States and Canada saying, come to Canada and work with us. We'll pay you 20 times what you get here.
So then when I've got Malawi, I can get a doctor.
That's right.
Hey,
So
you're from Malawi. That's nice.
That's right. And they steal the doctors that we need in Malawi. And then at the same point, at the same time, there will be some people saying, we're doing everything we can for Africa. Well, you're not, let me tell you. You can tell I'm getting a bit upset.
You are getting upset.
Very often you're not. They're not. They should be donating doctors to Malawi, not taking them from Malawi.
Yeah.
It's very easy to take things out of Malawi. Madonna knows that.
Now, that's what I was going to ask you. Because that's how I went, hold it, Dr. Brooks, Malawi, isn't that where Madonna went?
Yes, well...
And then she bought that baby there?
Well, that's not quite the expression that one ought to use, but she did. She got a baby. I think she's got 2 babies now. But you don't... It is easy enough to come in, to parachute... To parachute in, get a baby, and then fly out again.
So does something like that, where Madonna brings some publicity in Malawi, help you raise money for your...
I suppose that is true, yes. The way she has gone about it, I would not agree with, but she has raised the awareness of Malawi.
Why? Was it wrong what she did, or...?
Well, again, do you think that's a right way? Go and take a baby, take it off to America? That's not going to help them. How's that going to help 12 million people living in poverty? What you do is come over there and do the best that you can to help them in the circumstances in which they are.
Well, come and adopt 100, but leave them there.
Come and help them with behavioral change. Come and teach them how to get better education. Come and teach them agriculture. Come and help them in their health care. These are the things you do. You don't just pluck up a baby and take it out and take it to America.
So how many patients a day do you see when you're there? Since you're the only doctor.
I started off seeing about 200 or 300 a day, which is absurd. I mean, how can you do that? You can't do it. And I would come through and I would see people with malaria and tuberculosis and HIV/AIDS all the time. All the time I was seeing it. And sometimes I could do things, sometimes I couldn't. I do the best I can.